It's one of the most researched and trusted supplements for building strength and boosting performance. But it's not just for bodybuilders. Let's welcome back Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine, to help break down what creatine does, who it's for, and how to use it safely. Glad to have you back.
Good.
So creatine, and then there's one that sounds just like it, looks just like it. How do you pronounce it again?
Creatinine.
Creatinine. What's the difference between those two?
Oh yeah, they very often get confused in a sentence. So people say, oh, I took my loading dose of creatinine, and I'm like, no, it's creatine.
Oh, okay.
So creatine is a compound that we take to help with body muscle recovery. There's controversy as to actually if it builds extra muscle cells, but we know that it does help with recovery after a big exercise. It helps with building muscle mass. And there's some other benefits to creatine therapy. There are also some warnings we'll talk about.
Okay.
But creatinine is the breakdown of muscle breakdown during normal daily use. Like if we go for a walk, some components of muscle breakdown will wind up in our bloodstream and then in our urine in usually regular amounts. So we can use those levels to check for kidney function. So if somebody's creatinine is going up in their bloodstream, that usually means renal failure or kidney failure.
Oh,
okay?
I see. Okay, okay. So, and then when we see creatinine going down, we add creatine and we're building our muscle strength back up again? Or
well, not really so much. I mean, low creatinine in the bloodstream means low activity often.
Okay.
So somebody who's very sedentary, somebody who's maybe a vegan or a vegetarian might have low levels. But creatine itself works on muscles, works on brain. So it doesn't mean if you're low in creatinine, you should take more creatine.
Oh, okay. Well, I appreciate that distinction. So, and you say it's not just for the bodybuilders, but it's also for right up here.
Right.
And our brains use a lot of energy. So using creatine is this going to help with brain fog?
Cognition.
Cognition.
Yeah, there are studies emerging now, more recently, that creatine supplementation does help the brain because creatine works on ATP production in the mitochondria. And our brains are very high energy, they use a lot of fuel. And so if we can add more ATP, which is the energy currency, if you will, for the brain, that is a way to do it, using creatine, amongst other things, to help with cognitive function.
How do you incorporate that into your diet? Is it sourced from foods that you eat, or do you have to take that as a supplement?
It can be sourced for some foods, but not in high quantities, so it's usually a powder. People buy the creatine powder. It has to be nice and good quality, and you mix it in a smoothie, let's say, and take that right before a workout or on a daily basis. In the old days, like 15 years ago, I wrote an article about creatine and some warnings about kidney injury, about renal injury. For bodybuilders who were loading, they were taking a loading dose, really high levels, 4 times the normal maintenance level.
That sounds risky.
Yeah, it is. It can actually impact the kidneys in a bad way and cause renal insufficiency or renal failure. So I don't recommend loading.
No.
Do it nice and slow and low, as I say, and you can use anywhere from 2 to 5 grams, not milligrams, but grams per day safely. But talk to your doctor, because if there's any incidence of or evidence of kidney injury, you should probably not use it.
Does it have any adverse reactions to other things that you could be incorporating into your diet?
Well, anything that's nephrotoxic, which means kidney toxic, so certain medications that can harm the kidneys, like non-steroidal anti-inflammatory drugs and other agents that can harm the kidney. Some antibiotics can do it. If you do that on top of creatine at high doses, there could be a cumulative negative effect.
And what if you just accidentally combine these things on a one-time basis, that you didn't do it daily? Are you going to suffer severe damage, any damage, or do you have to repeat this on a daily basis?
Mostly repeating it. So if you take, let's say, 10 grams of creatine just once, the probability of it harming your kidneys is probably low. But if you do that kind of on a daily basis, day in and day out, then be careful.
We live in a society where we like to see immediate results. Is this something that has to build up in your system, or do you see an immediate positive reaction once you've incorporated
That's
it?
a great question, because most people will ask that. Now, bodybuilders, they like to see immediate response.
Yeah.
And I think with bodybuilding and muscle recovery, you're going to see more of an immediate within weeks.
Oh.
For cognitive enhancement, Layla, I think you have to wait weeks to months, maybe even 2 to 3 months before you notice a cognitive
That's
enhancement.
bad news for me. That means I'm going to have to get consistent because I need it.
And not forget to take it, right?
Yeah, that's the other thing. Make sure you set a timer or something daily to take it, which is not a bad idea because it's easy for the hours to just pass by during the day and you forget to take it. Well, creatine, it sounds like a wonderful supplement to add. And is it a vitamin? What is it exactly?
No, it's not considered a vitamin. I would just say it's a dietary supplement.
It's just a dietary supplement. All right, very good. Well, for any more information, if you want to get in touch with Dr. J.P. Saleeby, you can go to CarolinaHolisticMedicine.com. And thank you again.
Always a pleasure being here.
Always fun. We're back after this.